natus, perinatology, it is birth, then around the birth of the fetus. Yes, what we consider to be perinatal period, it is the age from 22nd week of pregnancy. We name this antenatal period. Yes, if something happened with the fetus, it is antenatal complications. Then we include in this period the period of delivery, intranatal or intrapartum period, part labor. Yes, and ends after 168 hours, 7 days after birth, postnatal period, and perinatal period include from 22nd to 7 days after birth of the fetus period, yes, of developing of the fetus. Why we take these 7 days? Now you understand, because we have transient states in this period. Some of these states can aggravate the condition, yes, if we don't pay attention to this, if we don't care on the fetus. And usually we have specific doctors, yes, neonatologists. Usually we ask for consultation if the woman is pregnant, yes, and listen for their opinion about, for example, monitoring of the patient, about the method of delivery. In every hour consilium take part neonatologist. It is the doctor who studies this perinatal period, yes, and usually in charge of these children which is born in this period. Then what study perinatal medicine? It is the features of the development of the fetus, pathogenesis and diagnosis of disorders and different diseases, then provision of the fetus and human modern versatile medical care before, during delivery, and after birth. And of course, the first aim of these doctors, it is reduction of perinatal mortality. The structure of the woman of the ovum, I don't stay on this question. Amniotic fluid, you maybe here they show you the substances and organs which take an active part in the development of the fetus. Of course, it is amniotic fluid, volume 1.5 liters, yes, and the functions of the amniotic fluid. Free developed fetus, protect fetus from environment, yes, from different harmful influence, involved in metabolism of the fetus, prevent any compression of the fetus and umbilical cord, and facilitate the normal childbirth, yes. Placenta, also provisional organ, yes, transparent organ, transient organ, yes, as transient stage in newborn, also placenta, but very significant if suffer placenta and has insufficiency, suffer feature. I told you about this organ, and also I don't stay a lot attention to this question. Provide exchange of substances between the pregnant and the fetus, and pay again attention to the functions of the placenta, because when I ask you about what does it mean placental insufficiency, we speak about it today. It is trophic. You don't know. It is failure of these functions. And functions of the placenta, it is trophic, endocrine, excretory, protective, gas exchange, then gas exchange, antigenic and immunogenic properties of placenta. And placenta not only integrate but shares the genetically heterogeneous organism of mother and the fetus, and preventing the immunological conflict. Umbilical cord, through vessels, you know, connected placenta with the fetus. And what this is the main to which we pay our attention. It is the methods of estimation of the fetal condition. They divided to non-invasive and invasive. Maybe biochemical screening, it is definition of the PAPA, chorionic gonadotropin level and alpha feta protein. Biophysical profile of the feature also estimate, and Doppler study of feta-placental complex, and perform cardiotachography. It is non-invasive methods. And invasive methods, which is very significant in some cases, it is amnioscopy, then amniocentesis, chorionic villus sampling, and then chordocentesis. And the simplest one, it is auscultation with a wood stethoscope, usually no any more better stethoscope than this, the simplest instrument for listening of the fetal heart beating, and very comfortable. What we estimate, first of all, fetal heart rate. Only with the help of this auscultation we can estimate the condition of the feature, which deals with distress, present or not distress of the feature. Noise of umbilical cord, very rare. I want to see aortic tonus, very, they are synchronous with pulse of the woman. Also, we can hear with the help of this auscultation. Uterine noise, very rare, and of course we can feel fetal movement when we listen fetal heart beating. Then biochemical screening. Usually, if speak in general about this method of investigation, the first aim of this method to reveal the defects of development of the feature in early age of pregnancy, and if it is necessary, to stop the pregnancy in order to not prolong pathological condition of the feature. For example, if we have Down disease, for example, or if we have abnormalities of the development, such as conjoined twins, maybe trisomia. I will show you these defects, the pictures of these defects. And great role play this method, biochemical screening. This screening based on the determination in the maternal serum metabolic products of the fetus to assess the functional status of fetal placental complex and forecasting of pregnancy. I told you their first aim. Determine the level of alpha feta protein, which synthesized by the liver of the fetus, chorionic gonadotropin level, and we determine also PAPA, yes, specific protein, that it is marker of chromosomal aberration in early aberrations in early pregnancy. Then more popular and very informative method, it is if combine this biochemical screening and ultrasonography. I of course choose ultrasonography. Pay attention, it's very significant when we perform this screening. Age of pregnancy highs, first trimester, it is from 9 to 13 weeks. Provide for the implementation of ultrasound screening studies to identify malformations and chromosomal abnormalities in early ages. It is very important when we can to stop this pregnancy with the help of indication of abortion, for example. In the second trimester, it is from 16 to 21st week of gestation. Usually also the aim to clarify the congenital malformation of the fetus. Then, and third trimester, from 30 to 33rd week, it's carried out to assess the dynamic of the fetal-placental system. The diagnosis of malformation with late onset may be present, and to determine if it is present intrauterine growth restriction. Till 21st week of gestation, we can stop the pregnancy with the help of artificial methods. Usually we again have the commission of doctors. Yes, we name this consilium, and they take the decision about prolongation or to stop this pregnancy. From 30 weeks of gestation, we wait for labor, excuse me, not from 30 even, from 22nd week of gestation, we wait for labor even if we have any complications of pregnancy. But in some countries, I know we change the age. For example, in England, they can stop the pregnancy till 24th week of gestation in England. Maybe, так, Nietzsche came to us. Nietzsche, who else? Так, участники. Нитхи, так, Нитхи, I want to point it. Where is Нитхи, my? Так, Нитхи, угу. And this third trimester also significant for us, and I want to say that more informative method of investigation we indicated only after 32 weeks of gestation, and usually it is, guys, a cardiotocography, usually from 32nd with week of gestation. You know that it is, you told me, I know that you know this, it is registration simultaneous of the fetal heart beating rate and uterine tone then. And what we determine, this is contractions of the uterus. We have basal line, it is heart beating of the fetus in normal, in quiet condition, yes, 130, for example. And you see contraction of the uterus, we have increase of contraction of fetal heart beating. This increase of contraction we name acceleration of the fetal heart beating, and it is normal reaction of the fetal heart beating to contractions of the uterus. You explain me this, yes, if uterus contracted, there is in this moment, we have the decrease of the supplying of the fetus by oxygen due to the, not only muscles contracted, but vessels as well, and that's why decrease the level of oxygen. That's why we have compensatory reaction of the fetus heart, fetus organism, looks like as acceleration of the fetal heart beating. If we receive late, for example, late effect of these contractions or deceleration, or there is no change of the contractions of the fetal heart beating, it is not a good reaction, and that's why doctors begin to think about not labor by nature, but think about the cesarean section, for example. Why that? In general words, cardiotocography show us the ability of the fetus to pass through the birth canal during labor, because of course it is a great load not only on the organism of the mother, but great load on the organism of the fetus. Also, you see that the woman hold in her hand applicator. When she feels the movement, she press this applicator. During the movement of the fetus, we also have acceleration of the fetal heart beating, and also this we have registration of this condition. Yes, acceleration we can receive not only due to contractions of the uterus, but also to movement of the fetus. Sometimes I want to say that I read the articles, if the fetus sleep, we have these moments. There is no good results of cardiotocography. In this case, you need to repeat it. For example, cardiotocography was in the morning, you should repeat it, this cardiotocography, for example, after 6 hours. In order to estimate really condition, because fetus can also have a rest and sleep. Then fetal biophysical profile based on the definition of the manifestation of various forms of fetal movement we registrated movement of the fetus, myocardial reflex, it is heart beating. Then we estimate the volume of amniotic fluid, and we take in account the ultrasound features of structure of the placenta. Together, myocardial reflex we registrated with the help of the same cardiotocography and make our conclusion about the biophysical profile. Very thoroughly, the indexes of biophysical profile describe the book, our obstetric and gynecology. You can take it in our library, and you can usually the good condition of the fetus, it is more than 8 points according to the biophysical profile. Every index we estimate from every point of biophysical profile, we estimate and count from 0 to 2 points. Then Doppler study, it is the method of measuring the velocity of blood flow in the mother, placenta, and fetus. And also this method allowed to determine the nature of violation of the mother and the fetus, as well as his critical condition. For example, reversal flow of the blood, absence of flow of the blood usually deals with placental insufficiency or absence of one of the vessels of the umbilical cord, which further lead to intrauterine growth restriction, to delay of development of the fetus and condition of distress. Usually, in general, it is the ratio between the blood flow in the veins and arteries, and this ratio, if it is normal, usually plus minus 3. Then invasive methods of investigation, guys, it is first of all amnioscopy. We use amnioscope, it is metallic tube, which we introduced to the cervical canal if we have slightly dilated cervix. This condition usually we have at the end of pregnancy. And now we perform this method of investigation and indicate it according to the strict indication. And usually in women who has postpartum pregnancy. For example, if there is no signs of labor activity in this woman, we need to perform amnioscopy. For what? Our first aim is to determine the condition of the fetus, and with the help of amnioscopy, we can see the color of amniotic fluid. If fetus suffer from distress, usually you know that if it is distress, it causes the relaxation of all sphincters, and meconium also appear due to the relax of the anus. Meconium appear in the amniotic fluid, and amniotic fluid stain with greenish color due to the presence of meconium. Sometimes it is chronic, if it is chronic hypoxia, which is possible if we speak about the postpartum pregnancy, amniotic fluid has brown color, yes, and usually it is one of the indications for cesarean. We need immediately to stop this pregnancy because fetus suffer from distress, and in most of cases unable to pass through the birth canal. We sometimes don't stimulate labor if it is postpartum pregnancy because condition is so severe. When at once we need to perform cesarean section, and it is one of the signs of fetal distress. Then, if amniotic fluid, also we perform amnioscopy if we have immunologic disease. We perform this we see the color of amniotic fluid in order to determine the presence of bilirubin in amniotic fluid, which is possible if the woman has immunological conflict with the fetus. Yes, and in this case, amniotic fluid stain with yellow color, and it is also very severe sign. Usually, we use this method as an additional method of investigation. Now it is not so rare, and look at this method of investigation. Other method of investigation, it is invasive method, which we call amniocentesis. You see here that under control of ultrasound, we introduced the long needle inside the cavity of the uterus, carried out starting from the 20th week of pregnancy, and resulting material is subjected to a broad spectrum of cytogenetic, biochemical, and DNA studies. Usually we take amniotic fluid for this. Indications, it is ante, intra, and postnatal fetal death, if for us unclear if the fetus died. Birth of the children with hemolytic disease, also Milimva came to us, yes. I'm very glad to see you, Milimva. Then hemolytic disease, yes, we inspected the amniotic fluid, yes, and estimate the titer. And wide range of pathologies in which early delivery is necessary. Amniocentesis, we take amniotic fluid from the uterine cavity. Then chorionic villus sampling, yes, the main method of invasive prenatal diagnostic in the first trimester of pregnancy, performed at 10 weeks of gestation. We use transabdominal or transcervical access. You see here transcervical access, yes, through the cervix. We appear in the cavity and make the sampling of the chorion villus, usually indicated in age patient over 35 years old, because a lot of chromosomal aberrations we see in this age of pregnancy. If it is old parents, yes, after 35, both men and women, I want to say. Then positive results of biochemical screening. If we receive results, something wrong with biochemical screening, I told you. Usually the genetics indicated the sampling of chorionic villus. The presence of echographic signs of chromosomal, no, I told you about the sign, about the chromosomal aberration, and presence of monogenic diseases in the family. If the family has the history of abnormalities of the development of the fetus, usually we indicated the sampling of chorionic villus. But we need to indicate this method only according to the strict indications. Both this method of investigation, it is invasive, yes, inside the cavity, and this sampling of chorionic villus here through the cervical canal, it is the gates for additional infection, and usually it can cause development of this infection if we sometimes perform this method of investigation. Then also, if we perform sampling of chorionic villus, maybe abruptio of the chorion, and this method of investigation can cause miscarriage. That's why it is severe. I suggest that and recommend it strongly indicated this method only if you see these abnormalities of the development during ultrasound. For me, it's more better. Only if the parents has the chromosomal diseases in the history. No, for old parents, it is the method of choice to my mind, because I want to say it's sometimes very severe to perform this method of investigation, as well as chordate synthesis. When under control of ultrasound, yes, we take the blood from the umbilical cord, yes. Usually we indicate it after 18th week of pregnancy, and usually to detect the chromosomal abnormalities, blood group of the fetus, rhesus, the level of hematocrit and hemoglobin, which is necessary if we speak about the hemolytic disease of the fetus due to the rhesus conflict, and also CBC analysis of the fetus, also if we speak about the rhesus incompatibility, also according to the strict indications, because the method itself cause the different complications of pregnancy. First of all, it is miscarriage and septic conditions cause infection. Of course, we use medical and genetic counseling. No, you see here indications: congenital malformation or hereditary diseases, then birth of the children with malformation, then marriage between close relatives, usually it can cause, chromosomal aberrations, infertility or recurrent miscarriage, amenorrhea, maybe perinatal mortality, amenorrhea due to the effects of development of the woman, teratogenic and mutagenic influence factors on the parents, and complicated pregnancy, of course. I can show you malformations of the womb, abnormalities or congenital malformations. Yes, maybe inherited, maybe exogenous and multifactorial. Inherited, it is genetic disorders, exogenous due to harmful influence of the environment, and mixed maybe. Yes, causes again the same. I don't pay attention to this. You need to know that terminology, guys. Gametopathias and blastopathias, changes in the genetic apparatus, and may occur in the process of maturation of the sex cells during fertilization or in the early stages of cleavage of fertilized egg. It is first 15 days. We name this gametopathias and blastopathias. These pregnancies, if we have this condition, usually terminated spontaneously. Guys, we have 10 minutes. Spontaneously in the 3-4 weeks after injury. Embryopathy in the period from 16 to the 10th week after conception. Often miscarriage and stillbirth. And fetopathies, it is period from 11 to until the birth. Guys, these disorders of development, maybe you need to know this terminology. What does it mean? Macrosomia, hypoplasia, aplasia. No, I hope that you look through and make your conclusion. Classification of congenital malformation. Usually, the first malformations, it is cardiovascular system and central nervous system malformations. I don't ask you to remember this classification, but questions about the malformation of central nervous system very often present in your ticket for exams. Yes, hydrocephalus, what does it mean? Yes, obstruction at one side of the circulation of the cerebral spinal fluid. Then anencephal, usually this fetus cannot live, they died just after labor. Yes, absent of the scalatus. It is malformations. Cephalocele, it is splitting of the skull. And pay attention to this. Protrusion of the contents of the skull through the bone defect. Distinguish cranial cephalocele, protrusion through a defect only meningeal membranes. Yes, this one. Encephalocele, when in the germinal sac tissues of the brain. Encephalocele. Spina bifida, sometimes you don't know how to explain this. It is lumbal herniation, midline defect of the dorsal vertebral arches, which is accompanied by denudation of the content of the spinal canal, usually treated with the help of the surgery, and very frequent defect. Then, among the malformation of the kidneys, it is polycystic kidneys. If both kidneys have this deformation, malformation, fetus died. Heart defects occupy the 90% of all defects. Yes, defect in the atrial ventricular walls, patent ductus arteriosus, pulmonary stenosis, hypoplastic left heart syndrome, and single ventricle may be present only. I don't gastrointestinal tract. Diaphragmal hernia may be present, you see here, yes, hole in the diaphragm, or more frequent it is omphalocele, umbilical hernia, possible surgical treatment. We estimate this condition just during pregnancy, yes, and wait for labor, and then we remove this defect of development. Gastroschisis. It is abdominal wall defect in the umbilical region with eventuation of the bowels. It is more frequent, to show you more frequent defects. And atresia of esophagus. In this case, non-stop vomiting in newborn usually present. Also possible operative treatment. Usually it is according to hereditary. You see here splitting of the, it is defects of skull. Yes, cystic gydroma usually needs in cesarean because the fetus engaged to the pelvic cavity with the largest size, with the extension of the fetus head. That's why only cesarean section in this case. Then malformation of the skeletal system, amelia, yes, aplasia of the limbs, tocomelia, hypoplasia of the proximal extremities, and aplasia of one of the bones of the lower leg of arm. Polydactylia, it is, you see here, increasing the number of fingers. Syndactylia decrease, and osteochondrodysplasia characterized by abnormal growth and development of the cartilages. Then, and chromosomal diseases, it is Down, it is Patau syndrome, trisomy to 13 pair of chromosomes, Edwards syndrome, trisomy to 18 pair. That's why such girls and such children and parents need to be in consulting with genetic. Sex chromosome abnormalities, we speak about it. Turner syndrome and Klinefelter syndrome. Then hereditary diseases, no, I don't pay attention to these guys. We have 4 minutes. I want to, it is multiple pregnancy. We'll need to speak some words about, we need to speak about the insufficiency placental. Guys, you know that placental insufficiency causes, first of all, preeclampsia. We speak about the pregnancy and extragenital diseases, cardiovascular, liver, diseases of kidneys. Disorders, what does it mean? It is disorders of failure of the work of the placenta and failure of the functions of the transport, nutrition, endocrine, metabolic due to the morphological changes in the structure of the placenta. Risk factors of placental insufficiency, it is woman younger than 17 in pregnancy and over 35 years. lack of food, for example, adverse social conditions, toxic influence, bad habits, smoke and alcohol, infections, played great role in the development of the insufficiency. First of all, it is torch infections, extragenital diseases, gynecological diseases, maybe tumors of the uterus, chronic inflammation or endometritis, for example. Complications of pregnancy, first of all, it is dystosis, latent, early, multiple pregnancy, anemia, and immunological conflict. All this deals with changes of the structure. Classification. You see here a lot of classification of maybe primary at the very beginning of pregnancy, secondary when developed due to the disease, for example, preeclampsia, which added in the second, second, third trimester of pregnancy. But usually we deal with acute and chronic placental insufficiency. If we speak about the acute insufficiency, it is suddenly rupture of placenta abruptly. If it is chronic, first of all, it is disease. Guys, we have only 1 minute. I need to speak with you about the fetal distress. Maybe tomorrow. No, not tomorrow. Maybe tomorrow we have stroke test, we have film about cesarean. That's why I can found 20 minutes to describe the fetal distress and fetal distress. It's very significant for us. And intrauterine growth restriction. Some words about this process, or maybe tomorrow, maybe 10-15 minutes, I will tell you about these conditions. Now, guys, the time is, we have only 1 minute. Again, I remind you, repeated the obstetric operations, all which you know. Operations which prepare the birth canal, cesarean, applying of forceps, abortion. We'll speak about this operation and I will show you very specific method of cesarean. Yes, and plus Krug test. I want to tell you goodbye. I beg my pardon because I cannot hear you, but I hope that you hear me. Yes, and if nothing happened, I will meet with you tomorrow at 9 o'clock.